So the first question is, what does your company do? And more importantly, why does it impact and change and improve health equity? What are you doing in the health equity realm?
So 50% of spine surgeries in this country are unnecessary. And I mean in this country, in the United States. And that's similar for musculoskeletal care. What I say is the wealthy in the United States get care they don't need, the poor don't get care that they need, and few Americans are getting the right care. So the number one solution to improving this is really to get the right care, which in the vast majority of cases with musculoskeletal care is physical therapy. Why don't people get the right care? There are a lot of barriers to care, like time, transportation, cost, and these disproportionately impact people of color, rural Americans, underserved urban communities like the Bronx, where I worked for a number of years as a spine surgeon. AI care delivers physical therapy in a revolutionary way. AI, meaning artificial intelligence care, really revolutionizes the way we're able to expand access to the vast majority of Americans. What we find here is that when we actually expand care like this, we see the best outcomes with our members of color, with rural Americans, people from underserved urban communities where we're able to really break down those barriers that disproportionately impact these populations. And I think also importantly is when we digitize a solution, we can't create new barriers, right? So we're very cognizant of that. We really try to minimize those barriers, for example, by supplying a free hotspot to anyone who doesn't have access to Wi-Fi. So this is where when we create solutions that overcome existing barriers, we also have to be wary of new barriers and make sure that we're really breaking those down as well. So that's what we do at Sword.
Fantastic. And by the way, I'm not only a panelist, I'm also a client. Although I understand that if I wasn't for Blue Shield, I get the fancy thing on my phone that tracked my thing rather than having to wear the old sensors. But
I love it, yes, because computer vision has really revolutionized the way we do things
yeah,
today.
I want to know a real example from each of you of where what you did moved the needle with one of those with an underserved group, and they were at some point before and they were at some point after that made a difference because of what you guys and what your organization, your companies and products did.
So, I mean, what we see is, and we've done several health equity studies, the best outcomes when it comes to pain, functional outcomes, actually we see with our African American Hispanic patients. And when we actually look at engagement, we see double the engagement with our rural American population when we look at zip code compared to the average population. So again, when these barriers that disproportionately impact people of color, rural Americans, underserved urban communities, and we attack those, I think we're really able to make an outsized difference in terms of impact in these groups. I think there are three reasons. One, digitizing care breaks down the barriers in time, transportation, and cost that disproportionately impacts these groups. Two, we enable people to choose their own physical therapist. Why do I mention that? I think in healthcare, the person delivering care is as important as the care being delivered. That connection is so important when it comes to actually making a meaningful change in your health outcomes. And then I think also supplying the right technology, like the mobile hotspot that I mentioned earlier. So we kind of think through all of these things as ways we're breaking down barriers and how they translate into the outcomes that we're seeing.
Fantastic. I love that. You never offered me a mobile hotspot. I'm teasing. I'm probably not the.
It means I think that your Wi-Fi connectivity is quite good.
And I want to raise the ugly point that you may have noticed there's an election coming up, and you may also have noticed that currently in the current administration, the health equity, diversity, inclusion, all that good stuff is actually right there in CMS policy. It may not be, depending on who wins coming up in November in the US. So I don't know who wants to go with this, but what do you think that's going to mean for your work? Does anybody think that that's going to change anything? Are you going to have to double down on stuff? Are you going to have to change the way you behave? I want to get some things about where do we think health equity is going to be as a principle, in January, particularly if one side rather than the other wins.
I really think for us, this is about, whether or not, one candidate or other wins. I think we are going to be charting our course exactly the same way, which is, delivering the right care to every person.